Do you really know what the risks and benefits of offering raw bones to your dog are? In this complete guide, we reveal everything owners need to know before including this food in their diet. We explain which types of bones are safe for different sizes and ages, how to avoid fractures, choking and contamination, and how to make the most of the natural nutrients they offer. We also show you the most common mistakes, such as how to prepare, store, and offer raw bones safely, and when to avoid using them entirely. Watch to the end to learn how to turn raw bones into a healthy and enriching resource for your dog without putting his life at risk. If you want to ensure safety and health for your dog, subscribe to the channel. Activate the bell. When we talk about raw bones in canine food, few topics generate so many contradictory opinions. On the one hand, advocates claim that they are a natural and complete source of calcium, phosphorus, and other minerals, in addition to helping with oral hygiene, jaw strengthening, and behavioral enrichment. On the other hand, critics warn of risks such as dental fractures, choking, intestinal perforations, and bacterial contamination. And, as with any topic related to animal health, the truth is not in the extremes, but in the balance between quality information and responsible practice. Before you put a raw bone in front of your dog, you need to understand that there is no absolute yes or no. There is the right way to offer it, the right time, and the appropriate choice of bone type. The first point is to differentiate raw bones from cooked bones. Raw bones, when of good origin, have a malleable structure covered by meat, fat, and cartilage, which allows the dog to chew and break into larger and less cutting fragments. Cooked, roasted, or grilled bones, on the other hand, undergo structural changes. They lose water, become more brittle, and break into sharp splinters, capable of perforating the esophagus, stomach, or intestine. Therefore, rule number 1 is clear. Never offer cooked bones. In the case of raw bones, the benefits can be significant when used consciously. Chewing fleshy bones helps remove plaque and tartar, boosting gum health and preventing periodontal disease. In addition, the act of chewing releases endorphins, reduces stress, and provides mental energy expenditure, something essential especially for active or anxious dogs. Nutritionally, raw bones are natural sources of calcium, phosphorus, magnesium, and collagen, all of which are important for bone and joint health, particularly in growing dogs. But for puppies and small dogs, the choice of bone type is even more important. Soft, fleshy bones, such as chicken neck and wing, rib tip, or beef knee, are safer because they allow complete chewing without high risk of tooth fracture. Long and dense bones of large animals, such as bovine shins, should be offered only to adult dogs of adequate size, and even then under supervision, to avoid fissures and excessive wear of the teeth. Another crucial factor is the origin of the bone. Intensively raised animals may have a higher presence of antibiotic residues, hormones, and even contaminants, such as salmonella or E. coli. Although dogs have a more resistant digestive system than humans, this does not mean that they are immune, and puppies, elderly, or dogs with low immunity are more vulnerable. Ideally, you should purchase raw bones from reliable suppliers, store them frozen, and thaw them safely, preferably in the refrigerator, to minimize microbiological risks. The way it is offered also influences security. You should never give a bone to a dog and leave it alone, especially the first few times. Supervision is essential to intervene if the animal tries to swallow a piece that is too large, has difficulty chewing, or shows signs of choking. In addition, limiting the time of gnawing helps prevent tooth wear and excessive ingestion of fragments, which can cause constipation or intestinal obstruction. It's important to understand that not every dog is prepared to deal with raw bones right from the start. Dogs used only to kibble may not know how to chew properly, swallowing large pieces and putting themselves at risk. In these cases, the introduction should be gradual, starting with softer bones that are easier to grind and carefully observing the animal's behavior. Another common mistake is to offer raw bones as a substitute for a full meal without considering nutritional balance. Although they provide important minerals, raw bones do not meet all of a dog's needs. In the context of the BARF diet, for example, they should make up 10 to 15% of the total meal, balanced with meat, offal, and vegetables. Excess bones can lead to severe constipation and an imbalance between calcium and phosphorus, with negative impacts on bone and muscle health. For dogs with a history of gastrointestinal problems, fragile teeth, or chronic diseases, the introduction of raw bones should only be done with veterinary guidance. In some cases, you may need to replace them with safe alternatives, such as calcium supplements or high-strength nylon and rubber chew toys. At the end of the day, raw bones can be a powerful health and wellness tool for dogs, but only when the owner understands how, when, and what type to offer. Without knowledge and supervision, the risk outweighs the benefit. And in natural food, the goal is always to enhance health, not put it at risk. The secret lies in careful planning, a watchful eye, and responsible choice. The use of raw bones in the canine diet requires more than knowing which ones to offer. It is necessary to deeply understand how they interact with the animal's health over time. The impact is not limited to the moment of chewing. It extends to digestion, nutrient absorption, and even dog behavior. Therefore, understanding each step of this process is essential to make safe and beneficial decisions. One of the first issues to consider is digestibility. Unlike us, dogs have a highly acidic stomach, capable of efficiently dissolving raw bone fragments when offered in the correct proportions. The fasting canine stomach pH reaches extremely low levels, facilitating the breakdown of calcium and phosphorus present in the bones. This means that when chewed properly, raw bones not only clean your teeth, but also provide minerals in a highly bioavailable form. However, this digestive capacity is not infinite. Offering excess bones without balance with other food groups can lead to constipation, whitish stools, and even intestinal blockages. Another point of attention is the relationship between the size of the dog, the strength of the jaw, and the type of bone. Dogs of large breeds and high bite power, such as Rottweilers or German Shepherds, can grind hard bones easily. But this also increases the risk of tooth fractures. Small dogs or puppies, on the other hand, need soft bones, covered by meat and with little mineral density, such as chicken necks and wings or lamb ribs. Here, gradual adaptation is key. Start with smaller, easier cuts, observe chewing, and only then move on to more robust bones if necessary. Prolonged chewing of raw bones also has a positive effect on behavior. Many dogs live in environments with little mental stimulation, and gnawing on bones is an activity that occupies the mind, reduces anxiety, and relieves boredom. This is especially useful for dogs with a tendency to destroy objects in the house due to frustration or excess accumulated energy. However, to avoid behavioral problems, it is important to establish clear rules. The bone must be offered in a safe place, removed after a certain time, and replaced by another activity, preventing the dog from developing excessive possessiveness. In the nutritional aspect, raw bones do not only offer minerals. Cartilage provides collagen, chondroitin, and glucosamine, which are essential elements for joint health, especially in dogs that will grow to large. Bone marrow, in turn, is rich in healthy fats and fat-soluble vitamins, but it should be offered in moderation due to its high calorie content. In excess, it can cause diarrhea or unwanted weight gain. Correct handling and storage are crucial to reducing contamination risks. Raw bones should be kept frozen until the moment of use and thawed slowly in the refrigerator, never at room temperature, to prevent the proliferation of bacteria. In addition, any leftovers should be discarded after the chewing session, even if it still looks good. Contact with saliva accelerates decomposition and increases the risk of bacterial growth. When we talk about safety, it is also essential to know warning signs during and after consumption. Coughing, frequent gagging, excessive effort to evacuate, vomiting, or apathetic behavior in the following hours may indicate that the dog has ingested inappropriate fragments. In these cases, veterinary intervention should be immediate, as intestinal obstructions or perforations can evolve quickly and put the animal's life at risk. And we cannot forget that the act of offering bones must be part of a structured eating plan. In diets such as BARF, the amount of fleshy bones is calculated as part of the total daily nutrients. Ignoring this ratio and adding extra bones as a treat can create calcium and phosphorus imbalances, compromising the absorption of other important minerals like magnesium and zinc. Finally, it is important to reinforce that not every dog should receive raw bones. Animals with advanced dental problems, a history of pancreatitis, chronic gastrointestinal disorders, or certain metabolic conditions may not benefit and even harm themselves from this practice. In these cases, consultation with a trusted veterinarian, nutritionist, or general practitioner is essential before any attempt at inclusion. Offering raw bones is not just an act of feeding, but a complex care that involves anatomical, nutritional, and behavioral knowledge. When done responsibly, it can have significant benefits for the dog's physical and mental health. But when misconducted, it can quickly turn into an avoidable risk. The difference between one scenario and the other is in the preparation and awareness of the tutor. Getting to the most advanced level in the use of raw bones means mastering not only what to offer, but also how to integrate this practice into the dog's routine in a balanced, safe, and sustainable way in the long term. This is where details come in that go unnoticed by most owners, but that make all the difference in the health and well-being of the animal. One of these points is the chewing time. Many owners believe that leaving the dog with the bone for hours is beneficial, but this can have the opposite effect. The longer the dog chews, the greater the chance of excessive tooth wear or ingestion of fragments that have already lost their flesh and cartilage, becoming hard and difficult to digest. Therefore, the ideal is to limit the chewing session to 20 or 30 minutes, removing the bone before it becomes dry and rigid. This management prevents problems and keeps the practice as something positive, not harmful. Another factor is the size of the bone in relation to the dog's mouth. The rule of thumb is that the bone should be large enough that it doesn't fit in one piece in the mouth, preventing it from being swallowed dangerously. At the same time, it should not be so heavy that the dog cannot handle it easily. This applies both to large breeds, which need bulky bones to prevent choking, and to small dogs, which benefit from proportionately smaller bones but still safe to chew. In the context of diets such as BARF, it is necessary to consider that the type of bone directly influences the proportion of calcium and phosphorus ingested. Bones that are more spongy and rich in cartilage, such as necks and knees, tend to be easier to digest and offer a balanced mineral ratio. Long and dense bones, such as femurs and bovine tibiae, have less cartilage and more mineral density, which can alter this relationship and, in excess, cause constipation and renal overload. Adjusting the frequency and variety of bones ensures that the dog receives the benefits without overloading. It's also critical to recognize that the dog's behavior while chewing reveals a lot about their experience with raw bones. Dogs that chew calmly, gnawing and breaking pieces gradually, tend to have fewer problems. Those who try to grind at full strength or swallow hastily need more supervision and often softer bones or shapes that encourage slow chewing. Post-consumption hygiene is another point that differentiates a careful owner from one who takes unnecessary risks. After the session, one should thoroughly clean the place where the bone was offered, wash utensils, and even check the dog's teeth to ensure that there are no splinters stuck between them. This routine prevents the accumulation of bacteria, fat residues, and possible gum inflammation. An extra important precaution is to observe individual tolerance. Even following all the rules, some dogs just don't adapt well to raw bones. Symptoms such as frequent vomiting, very hard stools, blood in the stool, inappetence or abdominal discomfort indicate that the practice should be stopped and re-evaluated with a veterinarian. Adaptation should not be forced. The goal will always be to improve the animal's quality of life, not to create a constant risk. For dogs that adapt well, raw bones can be used as a strategic tool for specific moments, such as relieving boredom on rainy days, helping with teething in puppies, or providing a natural calcium boost for lactating, as long as cleared by the veterinarian. In these cases, the tutor already has experience and knows how to adjust the type and size of the bone as needed. Finally, it is important to remember that the dog's relationship with the bone is also emotional. For many, receiving a raw bone is a moment of intense pleasure, which stimulates instincts and brings physical and mental satisfaction. Integrating this into the routine, in a controlled and conscious way, strengthens the owner-dog bond and creates an enriching experience for both. When the practice is done with knowledge, attention, and respect for individual limits, raw bones are no longer just food to become a multifunctional resource. They strengthen the body, keep the mind active, and contribute to a healthier and more balanced life. The secret is simple, but it requires discipline. Offer less often, but with more quality, supervision, and planning.